All right, let's talk about something that touches all of our lives, whether we realize it or not. We're diving into the world of clinical psychology.
I mean, we've all been there, right? That feeling, that knot in your stomach before a big presentation, or, waiting till the very last minute to study for a test. These are the kinds of super common, totally human feelings that are actually the perfect gateway into what clinical psychology is all about. Okay, so let's get right into it. What is clinical psychology? It's the science of relieving psychological distress. And trust me, it's not always what you see in the movies. At its core, it's a science dedicated to helping us, well, figure out our own complex inner worlds. So here's the official definition. It's the branch of psychology that helps understand, prevent, and relieve psychological distress and promote well-being. But what does that really boil down to? It's an applied science. That means it takes real, evidence-based research and uses it for a very clear mission, to help people feel better and live more fulfilling lives. It's really about getting to the why behind what we feel and do, so we can start to make some real, meaningful changes.
And when we say psychological distress, the scope is just huge. It's not just one thing. We're talking about everything from emotional difficulties and behavioral challenges to problems with social stuff or even intellectual issues. It covers the smaller things, like the stress of adjusting to a new job, all the way to really severe psychopathology. It just goes to show you, this field touches on pretty much every part of life.
All right, Section 2, From One Clinic to Worldwide, a brief history. To really get a feel for what this field is today, we've got to look at where it came from. And its roots are actually pretty recent, and they started with a need to solve some very real, very practical problems.
And this timeline really tells the story. It all started back in 1896. Lightner Whitmer opens the very first psychological clinic. And for what? For a kid who was having trouble with spelling. That's it. Now, fast forward a bit to 1914, and there are 26 of these clinics across the U.S., but they're mostly focused on assessment. Figuring out what's going on. Then comes World War I, and boom, the Army develops these mass intelligence tests, the alpha and beta tests. This really solidifies psychology's role in assessment. But the real game changer? World War II. Soldiers were coming back with deep, profound psychological trauma, and they needed help. This created this massive demand for actual treatment, not just tests. And that's really what pushed talk therapy to become the absolute cornerstone of the field that it is today.
So that's the history. But how does it all work today? Let's break down the actual three-step process. It's not some mysterious thing. It's a really structured and, more importantly, a collaborative journey.
And this quote, this just says it all. The client is the expert on his or her life, and the clinical psychologist is the expert in therapeutic intervention. I love that because it flips the old script, right? It's not about some expert in a chair telling you how to live your life. It's a true partnership. You are the world's leading expert on you. The psychologist? They're the expert on the tools and techniques that can help you navigate. So that process usually follows these three steps. First up is assessment. This is where the psychologist just gathers information through interviews, observation, maybe some tests to build what's called a case formulation. It's basically a complete picture of you and your situation. Step 2 is diagnosis. Now, they might use manuals like the DSM, but it's really important to know this isn't about just sticking a label on someone. It's more of a guide to help figure out the best path for treatment. And that leads to step 3, the heart of it all, intervention. This is where the actual therapy happens, and it's always tailored to the person. It might be something like cognitive behavioral therapy, which is all about our thought patterns, or maybe psychodynamic therapy, which looks more at how our past experiences shape us today.
Okay, new section, careers in clinical psychology. So when you hear clinical psychologist, what do you picture? Probably someone in a comfy chair in a private office, right? Well, that's part of it, but the career paths are way more diverse than you might think. They really fall into 4 main buckets. First, you've got clinical practice. That's the one-on-one work in hospitals, clinics, or private practice that we all think of. But then there's clinical research, where they're at universities or think tanks pushing the science forward. They also teach, in universities and hospitals, training the next generation. And finally, they do consultations, lending their expertise to everyone from NGOs to big private companies.
And within those jobs, they can specialize in almost anything you can imagine, from learning disabilities and child psychology all the way to things like addiction.
And just look at this. One really, really important specialization is the psychology of older people. Think about it. They're helping them cope with some of the heaviest things in life, the loss of loved ones, losing physical abilities, even changing social roles. It's incredibly vital work.
So why is this field so critical? I mean, why does this matter on a global scale? Well, let me just show you a number. 300 million.
That's how many people the World Health Organization estimates are affected by depression worldwide. And get this, depression is now the single leading cause of disability in the workplace. So this isn't some small niche issue. It is a massive global health crisis. And that fact alone makes the work of clinical psychologists more essential than ever before.
So given how important this all is, it should come as no surprise that actually becoming a clinical psychologist, well, it's a long and incredibly rigorous path.
And this table just gives you a little snapshot of what that looks like around the world. In the USA, you're looking at a PhD or a PsyD, plus a licensing exam and an internship. Over in the UK, it's an accredited degree followed by a 3-year doctorate. In Australia, it's a whole accredited pathway. And in Sri Lanka, it's a master's degree or higher, plus supervised training. So you see, while the exact path might change, the core commitment is always the same. We're talking years and years of advanced education, tons of supervised practice, and tough licensing. It's a huge dedication to mastering both the science and, really, the art of helping people.
So when you boil it all down, it's pretty clear. Clinical psychology is a tough, demanding field for sure, but it is absolutely vital. It's all built on science and driven by one single goal: improving mental well-being for all of us. And all of this leaves us with one last, really big question, right? We know millions of people are out there seeking support. We know this practice works. So the real challenge for all of us is, how can we reduce the stigma that still surrounds mental health? And how can we make this vital practice more accessible to every single person who needs it?